We're going to discuss the normal liver. We'll talk about Doppler of the hepatic vessels. We'll talk a little bit about diffuse liver disease patterns, then move into portal hypertension and focal liver masses. Now, the normal liver, when we look at it sonographically, we pay attention to the size of the liver, the shape of the liver, the echogenicity, and the echotexture. The echogenicity and echotexture are two different things that we talk about. Echogenicity has to do with the level of brightness of the liver parenchyma, and we use portal vein walls to compare that. And texture has more to do with the homogeneity of the liver. The liver is very susceptible to technique. We have to make sure that we have a nice, smooth TGC curve. We want to make sure that the penetration goes all the way back to the diaphragm. Here is this curvilinear bright structure. We would like to have the vessel wall, vessel lumens clear of extraneous echoes. And when we scan the liver, we want to make sure that we clear all of the margins of the liver. In this case here, we have very good technique coming through this side of the image. We have nice echogenicity, clear vessels. We get through to the diaphragm. But here we seem to have some kind of division, some kind of dropout of sound. So we would have to correct that, either apply better pressure on the abdominal wall and try to even out the echogenicity here of the liver. One thing that's very important, and this is important for all structures that we image in ultrasound, we always want to be able to see at least 2 to 3 centimeters beyond the margin of any organ so that we can exclude possibility of any exophytic masses or any kind of adjacent masses that can affect the organ. In this case here, this is the liver. The inferior edge of the liver would be here, but because we were trying to clear 2 to 3 centimeters beyond the margin, we noticed that there was a mass hanging off the inferior edge of the liver. We would have never seen it if we would have stopped our picture at the inferior margin of the liver. And if you, by the way, this was a hepatocellular carcinoma, a hepatoma, 5 centimeter hepatoma hanging off the margin of the liver. And if you think that this is an anecdotal or unusual case, here's another case that we had fairly recently. Hanging from the inferior margin of the liver was this large mass, another hepatocellular carcinoma hepatoma, and that's the right kidney here. Now, as you scan the abdomen, you should always have in mind the different parenchymal organ echogenicities and have a kind of a relative scale in your mind of the different echogenicities. The renal medulla is the least echogenic of all the parts of upper abdominal organs. It is much less echogenic than the cortex of the kidney, which in turn is less than or can be equal to echogenicity of the liver. We used to think that equal to the liver was abnormal, but now we know that especially in young people, cortical echogenicity could be equal to liver echogenicity. Now, we also know that the liver is less echogenic than the spleen, but that's something difficult to ascertain because usually the liver and the spleen are not on the same picture, and you would really need them to be side by side to tell which one is more or less echogenic. That can happen sometimes. Now, this is a scan of the left upper quadrant, and we're looking at the spleen here, and we notice that the spleen has sort of a double shade, has a darker area and a brighter area, almost like a double shaded spleen. However, we also note that there are some little vessels in this part of the spleen, not so much seen here. And then we realize that this is liver. This is the left lobe of the liver going all the way across to the left, hugging the spleen, and so that it looks like it's a part of the spleen, and it isn't. So this is liver, which is indeed less echogenic than spleen. And this is not to be mistaken for a subcapsular hematoma. Sometimes this is mistaken in the spleen. So there's our proof. Now, The liver is also less echogenic or equal in echogenicity to the pancreas. Pancreas usually more echogenic, but they can be equal, especially in younger people. So here is pancreas, and here's the left lobe of the liver, and they're fairly equal. When we compare echogenicities, we should be comparing at a similar depth of the beam. Oh, and one more thing here, that the pancreas itself is less echogenic than retroperitoneal fat, which is hyperechoic, and also less echogenic than the renal sinus echoes. So renal sinus echoes and the retroperitoneal fat are hyperechoic and the most echogenic of all of these parenchymal organs. When we look at the liver parenchyma itself, we realize that there are little holes throughout the liver. Sometimes we see little cylindrical shapes, and some of them have bright walls, and some of them do not. So then we have to figure out what we're looking at. When we do ultrasound sonographically, the vessels that are visible within the parenchyma of the liver are the portal vein walls and the hepatic veins. The hepatic arteries and the bile ducts typically are not visible within the parenchyma of the liver unless they are abnormally dilated. We can see them in the porta hepatis, which is just outside the liver, but as far as being inside the liver, we only see these two vessels. If you think about the liver, you realize that there are 4 tubular systems that go throughout the liver. We have the portal venous system, the hepatic arterial system, and the bile ducts. These are intimately related at the porta hepatis. They join together as partners in the portal triads, and they stay together throughout their entire branching throughout the liver. The 4th tubular system is the hepatic veins. Now, the hepatic veins drain the liver superiorly towards the IVC, inferior vena cava, and they stand alone. They do not have anything associated with them, and that becomes important to us. We'll see in a minute. So the portal triads then are maintained throughout the liver, and that's partially, that is what is causing this reflectivity of the walls. Portal veins have bright echogenic walls, and we use this for comparison of parenchymal echogenicity. What happens is the main portal vein, it enters the liver through the porta hepatis and almost immediately splits into a right and left portal vein. The largest portal veins divide horizontally approximately in the middle of the liver, and they supply lobes and segments, and they carry blood flow into the liver. Now, the reason that portal veins have bright walls is, number one, because of the portal triads, which is the portal vein, the little hepatic artery, and the bile duct. So all we're seeing here is the portal vein. The little artery and duct are small, so they just provide reflectivity. We also have some reflectivity from Glisson's capsule, from the little lymphatics and nerves and connective tissue around the portal triad. So that's why portal veins have bright walls.